Hey guys, welcome to our channel. Today I'm going to discuss how to logically rule out options in a MCQ. So now let's move to the question. An 8-year-old boy presents with a headache for the past 2 weeks. His headaches tend to occur in the morning with associated nausea and vomiting. So we will probably suspect this as a case of meningitis. The next line is very important. An MRI of the brain shows bilateral ventricular enlargement and enlargement of the subarachnoid space. So they are asking the most likely explanation for the patient's condition. So before moving to the option, we should have a rough idea about the CSF pathway. The CSF is produced in choroid plexus, we all know, and after production, it moves to the lateral ventricle, then to the third, and then to the fourth ventricle. Then it moves to the subarachnoid space, then to the arachnoid villi, there will be arachnoid granulations, and finally to the dural sinuses. So, with this in mind, let's move to the first option, that is increased CSF production by the choroid plexus. So, guys, let's think. If there is increased production, what will happen? There will be obviously enlargement of the ventricle and the subarachnoid space. So let's come to the option later. We will put that question mark. The next option is embed CSF flow through the arachnoid granulation. So they are saying there's a block in this level. So what will happen? If there is a block at the arachnoid granulation, that is arachnoid villi level, there will be enlargement of the subarachnoid space and also the enlargement of ventricles. So the both will occur. So we should consider this option also. Let's put a question mark. The third option is embed CSF drainage into the fourth ventricle. So this level, there is a block. So what will happen if the block is to the fourth ventricle? There will be enlargement of the third and the lateral ventricle. So the ventriculomegaly will be present, but there will be no enlargement of the subarachnoid space. So this option is ruled out. So the next option is embed CSF drainage into the subarachnoid space. At this level, there is a block. So what will happen? Obviously, there will be ventricular enlargement, but no enlargement of subarachnoid space. So this option is also ruled out. So we are finally at two options. The choroid plexus option and the arachnoid granulations embed CSF flow. So let's see, guys. If the option A is the right answer, in the question in MRI is mentioned, how will the increased production or what would be the cause of the increased production by the choroid plexus? There will be a tumor of the choroid plexus, obviously. So what will be there in the question? There should have been a mass corresponding to the choroid plexus papilloma. So when we look at the question, there's no mention of the mass. So we can obviously rule out this option also. So the final answer would be what, guys? Option B, embed CSF flow through the arachnoid granulations. So that's all. Let's see with another question in another video. Thank you.